Hello, excited to be with you again from Unified OSCE. A big shout out to all OSCE passers, our subscribers and viewers. If you are yet to subscribe, kindly press on the notification button so you get updates as soon as we upload new videos. Yeah, let's get started. In this video, I'd like to take us through the Nutritional Assessment Station as a skill. Okay, the allotted time for the skill is 8 minutes. It is a combination of verbal and written station. We will make use of the malnutrition universal screening tool chart, by BAPEN, and the MOS chart is a standardized tool used to assess adults who are at risk of malnutrition, malnourished, or obese. In Unified OSCE, we always advise that you follow the marking guide, the marking criteria. So we have the marking criteria, just have a look and follow as stated based on the marking criteria. Now, what is expected of you? You are expected to complete the 5 steps and calculate the overall total MOS score. A scenario will be provided with access to the various charts that will help you through in this session. You need the weight in kilogram and the height in meters or in feet and inches, and you'll find that from your sample scenario. You need record of unplanned weight loss in the last 3 to 6 months. You need history of acute illness, and sometimes there may be no illness, but you need history of no nutritional intake for 5 days or more. Now, the chart on the screen, that is the 5-step MOS chart. You have your step 1, and you have this range of score 0, 1, and 2. You have your step 2, which is the weight loss history. You have your step 3, which is the negligible or no nutritional intake for 5 days or more. On step 4, you add up your step 1, your score, plus the score in step 2 and the score in step 3, and that gives you answer for step 4. And then the step 5, that will be your verbal review. You give a plan of care as regards the total score of your patient. So for your step 1, you need this chart, which is titled Step 1 BMI Score, which will be provided, like I said. You need this chart to calculate the BMI score. You don't need the formula of, you don't need to cram the formula of the BMI, which is weight in kilogram, divided by height in meters square. You don't need that. You just need the history of the current weight, the height in meters or in feet inches. And you need the second chart, which is the step 2 weight loss score. And this will be provided as well. You need the current weight and the history of the previous weight. Now let's move to the next one, which is the sample scenario that will follow in this station. The name of the patient is JJ. The date of birth is 1/1/1965. JJ lives alone and was recently diagnosed with severe hypertension. JJ is currently weighing 48 kilograms and his height is 1.6 meter. His weight in the last 6 months was 52 kilograms. JJ is on low sodium diet. His daughter helps him with his meal and is currently experiencing loss of appetite, but still managed to eat more than half of his meal. Your assignment: calculate the overall malnutrition score for JJ. For the step 1, how do we calculate that? The current weight for JJ is 48 kilograms. So on the vertical axis, titled weight in kilogram, I need to locate the weight, which is 48 kilograms, and point the arrow and go to the horizontal lane, which is the bottom line of this chart. I need to locate the height, which is 1.6 meters. Then draw an arrow upward. Then the points where the weight and the height intersect, I have 19, and that falls in the yellow, which is the score of 1. The color coded, you can see it is, we have different color coded red, yellow, and green. So we have we have a BMI score of 19 based on this weight and height, and that gives us a score of 1. So keep that in mind. So we move to the next chart, and the next chart we have to calculate the step 2, which is the history of weight loss. And what do we need? We need the current weight and the weight loss and the weight in the last 3 to 6 months. For this scenario, the current weight is 48 kg. The previous weight in the last 3 to 6 months is 52. So all I need to do is to subtract 48 from 52, and that gives me a weight loss of 4 kg in the last 3 to 6 months. So I come to the vertical axis here on this table and locate the weight, the current weight, which is 48 kilogram. Then the row in front of that, I try to check the range of that falls between 4 kg. We have the green one, which is a score of 0. We have the yellow, which is a score of 1. So for 48 kg and a weight loss of 4 kg falls between the yellow lane. And we can see we have, based on that, we have the range of 2.5 to 5.3. So which is a score of 1. That gives me a score of 1 for step 2. So 1 plus 1, we have 2. So now we move to step 3. What do we need to do? Step 3, I need to add a score of plus 2 if there is no dietary intake for more than 5 days for whatever reason. But in this scenario, we can see that JJ still managed to eat more than half of his meal. So that will still give us a score of 0. So I have 1 plus 1, 1 in step 1, 1 in step 2, and 0 in step 3. And that gives me a total score of 2. So now, step 4, what do I need to do? I need to categorize the risk. So I have a score of 2, which falls into the category of the high risk. Step 5, now, what do I need to do? I need to document this on the nutritional assessment form that will be provided in your OSCE station. The candidate's name. Please make sure you document your name. You know, it will be painful for one to have to go back because you failed to document your name. The name, address, and date of birth of the patient will be pre-filled. Then the date, today, the date of your exam, the time, based on the scenario you are given. Mine is 10th hour. The step 1, I have a score of 1. Step 2, a score of 1. Step 3, a score of 0. And I have a total score of 2. Name and initials. Print your name and sign as required. So I'm done. Now I have to go back to the assessor and relay my findings. Assessor, I'm back. I've done a nutritional assessment for JJ with date of birth 1/1/1965. JJ had a score of 1 on step 1 of the BMI, a score of 1 on step 2 of the BMI. For step 3, he had a score of 0. So a total score of 2. The overall score is a score of 2, which is categorized as high risk. So my plan of care, I will advise JJ to take small meals at frequent intervals. I will advise JJ to keep a diary or a record of his nutritional intake for at least 1 week. This is an hospital setting. I will like to re-evaluate JJ after 1 week. With JJ's consent, I will refer him to dietitian for further plan of care. I will also liaise with the dietitian to have a talk with the daughter to ensure his meal is prepared to his taste so that he can have enough and meal. For other settings, on your step 5, you have the standard plan. So just refer to the step 5 and read out the plan as stated out on the step 5 chart. That's all we have for you. Keep practicing and wishing you good luck in your exams. Until we come your way again, bye for now.